بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today we will talk about continue on responding to some symptoms in pharmacy practice. We'll continue on the GIT symptoms, and today inshallah we will discuss nausea and vomiting. Nausea and vomiting are symptoms that have many possible causes. From the pharmacist point of view, as a pharmacist, while there are many treatments that are available to prevent nausea and vomiting, disregarding the H1 antagonist, muscarinic antagonist, the dopamine receptor antagonist, 5-HT3 receptor antagonist, cannabinoids, phenothiazines, D2 receptor antagonist, a lot of drugs that having antiemetic effects by reducing vitamin B6. There is no effective OTC treatment once vomiting is established. Although there is a lot of drugs with different pharmacological mechanism of action having an antiemetic effects, once vomiting is established, the patient that now is complaining from vomiting, there is no OTC medication. All of these drugs are prescribed drugs. For that reason, inshallah, today this session, inshallah ta'ala, we will deal briefly in this section will deal briefly with some of the causes of these symptoms. What you need to know as a community pharmacist to respond well to a patient or a customer that complain from nausea and vomiting. You should know the age. Is it a child, infant, adult, elderly, pregnancy? You should know also if you're pregnant, because nausea and vomiting are very common in pregnancy, especially in the first trimester, especially if the pregnancy is for the first time. Also the duration and other symptoms that are associated with nausea and vomiting. You should know also how the patient vomiting started, because if we, as I mentioned, if it is already started, there is no OTC medication, you should refer this patient. Is there any abdominal pain, diarrhea, constipation, fever? You should ask the patient also about the alcohol intake and the medication already the patient taking this medication, is it prescribed or OTC medication? You should also know the previous history, and is there any dizziness or vertigo, because also this is can associated with nausea and vomiting. You should know the age, because the very young and the elderly are most at risk from dehydration as a result of vomiting, so that in case of vomiting in this young patient or very young patient, infant or elderly, also this situation you should repair, as we talked before. Vomiting of milk in infant that less than 1 year old may be due to the infection or feeding problems, or rarely an obstruction such as pyloric stenosis. In the elderly, there is a thickening of the muscular wall around the outlet of the stomach, which also can cause a blockage and can also this result in vomiting. Pregnancy, as you know, that nausea and vomiting are very common in pregnancy, usually beginning after the first missed period and occurring early in the morning. The pregnancy vomiting, nausea and vomiting characterized by the occurrence in the morning. Pregnancy should be considered as a possible cause of nausea and vomiting in any woman of childbearing age who presents at the pharmacy complaining of nausea and vomiting, so that if the patient is female and in the childbearing age, you should consider and she complains from nausea and vomiting, you should also take in your mind that pregnancy may occur. Nausea and vomiting are more common in the first pregnancy than in the subsequent ones. Also, the nausea and vomiting is occurred in the first pregnancy more than its occurrence in subsequent other later pregnancies. Generally, adults, this is regarding the duration of the symptoms, adults should be referred to the doctor if vomiting has been present for longer than 2 days. Children under 2 years are referred whatever the duration because of the risk of dehydration. Anyone presenting with chronic vomiting should be referred to the doctor since such symptoms may indicate the presence of peptic ulcer or gastric carcinoma. This is chronic vomiting. إذا chronic vomiting هو indication for refer to اللي هو exclude the possibility of serious disease or serious disorders such as gastric carcinoma or even the peptic ulcer. Regarding the associated symptoms with vomiting, an acute infection or gastroenteritis is often responsible for vomiting, and in these cases diarrhea also may be present, so that careful questioning about food intake during the previous 2 days may give a clue as the cause. You should know this can also help you to identify the cause of this vomiting or nausea or vomiting, which may be due to the food intake. The vomiting of blood may indicate a serious disease and as an indication for referral, so that if there is blood in the vomiting, this is an indication for referral, since it may be caused by hemorrhage from peptic ulcer, active peptic ulcer, or from gastric carcinoma. Although sometimes the trauma of the vomiting can cause a small bleed due to a tear in the gut lining، واحيانا يكون بالذات اللي هو احيانا قد يكون of minor origin due to a small bleed which result from اللي هو cutting او tearing في ال gut lining due to the vomiting او the trauma of the vomiting. In young children, the rotavirus is the most common cause for gastroenteritis, usually associated with cold symptoms. Vomit with the fecal smell means that the GIT tract may be obstructed and require urgent referral. So that the fecal smell in vomiting, this indicate require urgent referral due to the presence of the fecal in the vomit with the vomit, which may indicate the obstruction involved in the gastrointestinal tract. Nausea and vomiting may be associated with also with migraine, and also any history of dizziness or vertigo should be noted, as it may point to inner ear diseases such as inflammation اللي هو labyrinthitis and Meniere's disease, and both of these disease are اللي هو inflammation أو Meniere's disease هم عبارة عن inner ear diseases that can cause اللي هو can cause nausea and vomiting. Usually inner disease because inner ear disease هي associated with dizziness and vertigo because النتيجة الإفكت اللي بيحصل في vestibular apparatus resulting in dizziness and vertigo, and maybe this combined with nausea and vomiting. You should also ask the patient about the alcohol intake. People who drink large quantities of alcohol may vomit, often in the morning. This may be due to the occasional excessive drinking or due to the chronic ingestion of alcohol. The questioning of the patients about their intake of alcohol is a sensitive area and should be approached with tact اللي هو diplomacy أو due to the that الالكحول intake اللي هو stigma. Now we'll talk about medication that for nausea and vomiting. As we mentioned, prescribed and OTC medicines may cause nausea and vomiting, so that nausea and vomiting can result as drug-induced adverse effects. Example: aspirin and non-steroid anti-inflammatory drugs, also doxycycline, estrogens, steroids, and narcotic analgesics, morphine, or bethadine, heroin, and other drugs. Symptoms can sometimes be improved by taking the medication with food, but they continue if the patient should see. If they continue, the patient should see the doctor. The symptoms of nausea and vomiting not that result from drug-induced nausea and vomiting. Although you advised this patient to take it after food to minimize these effects, but if the symptoms continue, then you should refer the patient. Digoxin toxicity may show itself by producing nausea and vomiting, so patient who is taking digoxin, especially an elderly person, should prompt immediate referral where questioning has not produced an apparent cause of the symptoms. إذا كان المريض if the patient already taking digoxin and now he's developing nausea and vomiting, you should immediately refer this patient, because nausea and vomiting is a sign and symptom that can occur from digoxin toxicity. And as you know that digoxin is one of the drugs that having a lower therapeutic index, so its toxicity is very common. You should also know the previous patient history. Any history that suggests chronic nausea and vomiting would indicate referral of the patient. Now we'll talk about the management. Patients who are vomiting should be referred to the doctor, as we mentioned in the first slide. If the vomiting starts, you should refer the patient directly, who will be able to prescribe an antiemetic if needed. And this is not your responsibility. The pharmacist can initiate rehydration therapy in the meantime. While the patient that came complaining, he's complaining from vomiting which already started, it is better to give him rehydration therapy. If you evaluate this patient may be going to dehydrate, then you should refer the patient directly to the physician to prescribe antiemetic agent if the patient is needed. Now we'll talk about motion sickness and its prevention. And as you know, the motion sickness, one of the problems that may be associated with nausea and vomiting and vertigo due to certain situation. Motion sickness is thought to be caused by conflict of messages to the brain, where the vomiting center receives information from the eyes and the GIT and the vestibular system in the air. وده دائما قلنا هو عنده علاقة باللي هو الترافل، إذا كان بس اللي هو في السي، عشان كده motion sickness which is more common or more common during the traveling by sea. Also can be even by اللي هو flying plane أو حتى even by buses or cars. The person can develop this motion sickness. وهي the motion sickness result from the اللي هو conflict of messages, the messages that come to the brain from different parts اللي هو أو different organs, from the eyes, from the GIT, and from the vestibular apparatus. Due to the conflict on these of these messages in the brain, this will result in nausea and vomitings. The symptoms of motion sickness include nausea and vomiting paler and colder and cold sweats this is symptoms of اللي هو motion sickness. Any form of travel can produce these symptoms including air, sea and even road. Effective prophylactic treatments are available اللي هو O2C medication and can be selected to match the patient's needs according to the travel, according to the patient age and اللي هو journey itself the duration بتاعه. You can select appropriate O2C medication for each individual. What you need to know to respond well to prevent customer motion sickness. You should know the age, is it infant, child or adult, and you should know the previous history and the mode of travel, is it by car, bus, air, ferry or others. You should also know the length of the journey and the medication that patient taking or tried before. You should know the age because motion sickness is common in young children. Babies and very young children up to 2 years of age seem to only rarely suffer from the problem اللي هي motion sickness and therefore don't usually require treatment اللي هو babies and the young children اللي هو less than 2 years أو up to 2 years هم rarely إنهم suffer from motion sickness. قلنا motion sickness, we mentioned that the motion sickness is more common in young children. The incidence of motion sickness seems to greatly reduce with age, although some adults still experience symptoms. The pharmacist, regarding the previous history, the pharmacist should ascertain which members of the family have previously experienced motion sickness and for whom treatment will be needed. You should know as we mentioned, you should know the mode of travel and the length of journey because it can affect your choice of O2C medications that intended to prevent the motion sickness. Details of journey to be undertaken are useful. The estimated length of time to be spent traveling will help the pharmacist in the selection of prophylactic treatment since the length of the action of available drugs varies because we have drugs the duration of action بتاعها بيختلف من 24 ساعة from 24 hours 3 hours 8 hours according to the different drugs. Once vomiting starts there is little that can be done. So any medicine recommended by the pharmacist must be taken in a good time before the journey itself or before the journey if it is to be effective. Any drug to be effective should be given prophylactic before the onset of the journey or before the onset of the vomiting because if the vomiting start بيبقى بعد ذاك the benefit from this medication will be اللي هو هتكون very low. If it is a long journey, it may be necessary to repeat the dose while traveling and the recommended dosage interval should be stressed. The pharmacist can also offer useful general advice about reducing motion sickness according to the method of transport to be used. For example, children are less likely to feel or be sick if they can see out of the car. This ability to focus on such objects may help to settle the brain's recipient اللي هو of conflicting messages. فالأطفال when you let the child to see out of the car, this will اللي هو will decrease conflicting of the message that come to the brain during this journey or during this traveling. For any method of travel, children are less likely to experience symptoms if they are kept occupied by playing games, as they are therefore concentrating on something else. This is برضو واحدة من ال practical points which can help the children to avoid the motion sickness, to اللي هو to occupied by playing games. بالتالي هما their brains will concentrate on something else, so the conflicting of the message that will come during this traveling will be reduced, and this motion sickness will be effectively reduced. For many travel sickness sufferers, reading exacerbate the feeling of nausea. ودي بالذات طبعا هتكون في الادلتس اللي هم او في الادلت children. Reading will exacerbate the feeling of nausea, and this is known by only by experience. In addition to checking any prescription or OTC medicine currently being taken, the pharmacist should also inquire about any treatments used in the past for motion sickness and their level of success or failure. This is regarding medication, that what you will ask the customer if taken any other or tried before any other medication or medication to prevent or to prophylactic from this motion sickness, and to know the level of their success or failure. Regarding the management اللي هو هي طبعا قلنا هي prophylactic treatments for motion sickness are effective, and there is usually no need to refer patient to the doctor. Only OTC medication are اللي هو available are very effective. Anticholinergic activity is thought to prevent the motion sickness, and forms of the basis of treatment of anticholinergic agents, especially the hyoscine, اللي هو scopolamine. Hyoscine British Pharmacopoeia, scopolamine according to hyoscine according to British Pharmacopoeia, scopolamine according to USP. And antihistamine also, which have anticholinergic actions such as cinnarizine and bromistazine, are very effective in treatment or in prophylactic treatments for motion sickness. The antihistamines اللي هي cinnarizine, meclizine and bromistazine, all of them have the potential to cause drowsiness, and the bromistazine appear to be the most sedative because this antihistamine, all of them are first generation antihistamine that can cross the blood-brain barrier, resulting in drowsiness, اللي هو sedative effect, sedating antihistamine, and the most one that of these drugs that produce sedation is the bromistazine. Meclizine and bromistazine have long duration of action and are useful for long journeys, since they only need to be taken once daily. If you are planning for a journey by a ship that may take 10 days or 2 weeks, it is better to have this one of these choices, meclizine and bromistazine. We mentioned that bromistazine available as OTC medication. This but in our country not OTC due to some restrictions. لأنهم هم they have a long duration of action, so that they are a good choice for long journeys because they can be taken only once daily. Cinnarizine and bromistazine are not recommended for children younger than 5 years, whereas the meclizine can be given to those over 2 years. The only anticholinergic used widely in the prevention of motion sickness is hyoscine, اللي هو scopolamine, hyoscine hydrobromide, which can be given to children over 3 years. إذا we have الهيوسين can be given for children over 3 years. الميكلوزين can be given for those over 2 years. And we have a Sinarizine and Bromistazine for children over 5 years. Children could be given sweets to suck to counteract any drying of the mouth, because all of the anticholinergic drugs, the first side effect of anticholinergic drugs is اللي هو dry mouth. فبالتالي to counteract, to avoid this اللي هو drying of the mouth, we can the children can given sweets to suck to avoid اللي هو dryness in the mouth. Hyoscine has a short duration of action from 1 to 3 hours. It is therefore suitable for shorter journeys and should be given 20 minutes before the start of the journey. Anticholinergic drugs and antihistamine the antihistamines that having anticholinergic effects are best avoided in patients with prostatic hypertrophy because of the possibility of urinary retention, and in the glaucoma because of because the intraocular pressure might be increased, and we mentioned this before. Pharmacists should remember the side effects from anticholinergic agents that having anticholinergic activity اللي هم معناها هيعمل لي additive and may be increased in patients already taking drugs with anticholinergic effects such as tricyclic antidepressants such as amitriptyline والبيتوريفينونز such as الهالبريدول والفينوسيازين such as الكلوربرومازين. All of these drugs having anticholinergic effects, antimuscarinic exactly. فبالتالي لما نديهم مع anticholinergic drugs we can increase the possibility of the anticholinergic adverse effects واللي هم dry mouth, urinary retention, constipation, blurred vision, even may cause tachycardia and CNS effects اللي هم confusion. In this table we have the O2C drugs for motion sickness prevention and their the minimum age of use. We have a Sinarizine 5 years, Hyoscine 3 years, Meclizine 2 years, Bromistazine 5 years, and the dose in children and the adult dose, and the timing of the first dose in relation to the journey. Sinarizine should be given 2 hours before the journey, Hyoscine 20 minutes before the journey, and we have الميكلوزين previous evening or لأنه هو عنده long duration of action يعني يتأخذ before 1 hour before أو even اللي هو previous evening. also البروميسازين previous ending or 1 hour before لأنهم عندهم long duration of action اللي هو 24 hours، وده اللي هو السيناريزين 8 hours الهايوسين 6 hour. دي اللي هم دي recommended dose interval for these drugs. We have alternative approaches to motion sickness. We have ginger. Some years ago it was found that ginger powder could effectively reduce motion sickness. No mechanism of action has been identified, but it has been suggested that ginger acts on the GIT tract itself rather than on the vomiting center اللي هو في المظلة oblongata in the CNS in the brain or on the vestibular apparatus. This is the effect of اللي هو الجنجر، وهو نعتبره alternative treatment أو alternative prophylactic treatment for motion sickness. هو طبعا موجود في شكل بتاع كابسول باودر كابسول. اللي هو ginger could be worth trying for a driver who suffered from motion sickness because الدرايفر احنا عنده مشكله هنا، هيكون عندنا مع الدراجز اللي انا يمكن تعمل له sedation، تعمل له drowsiness، since it does not cause drowsiness, because zinger, not like an antihistamine or anticholinergic, which both of them can cause drowsiness, and might be worth considering for the use in pregnant women for whom other antiemetics such as anticholinergics and antihistamine are not recommended. We have also الاكيوبريشر اللي هو wrist bands, acupressure wrist bands, following their apparently successful use on board اللي هي naval ships to reduce the motion sickness. Elastic اللي هو elasticated wristbands that apply pressure to a defined point on the inside of the wrist are now readily available. As yet, there is no consistent evidence from the clinical trials regarding these acupressure wristbands for the effectiveness of this method, but research is continuing. Such wristbands might be worth trying for drivers or pregnant women because they are free of adverse effects for the drivers and pregnant women, and this is the اللي هو wristbands. That is all regarding this GIT symptoms اللي هي nausea and vomiting and the motion sickness. Thank you and السلام عليكم ورحمة الله وبركاته.